all around. The first topic is the adductors. Yes, adductors, as we saw in the theory and we discussed them, the exercises. The first row is mobility, then you start doing strengthening, and then functional strengthening with Copenhagen. So in initial stages, we want to start, like even for day 2, we do a small pendulum movement in and out, and then as the condition is improving, you can have a bigger pendulum. The same applies for hip flexion, extension, and then very good exercise is also pelvic mobility. Yes, this is also putting some nice loads, and then slowly can use either isometric inner range at the first days, and then as the adductor can open more and feel comfortable, you can do isometric mid-range or outer range, all dynamic with elastic band. Here you can work on the hip flexors isometrically and progressively dynamically. And exercise number 6 is engaging rotational loads. It's very important with an elastic band or a weight or transferring. The horizontal plane function is very important. And then the lower row is functional exercises, the whole kinematic change working. Number 8 is coordination, but also it can become dynamic. You know, the last weeks of the rehabilitation, the athletes should do really high jumps. And the Copenhagen. Because Copenhagen is one of the exercises for the criteria to return, that the rehabilitation is going well and you are completing. And we, as physiotherapists, we need to meet those 8 criteria. Pain-free palpation, palpating pain-free. Pain-free maximal isometric pushing down outer range. Pain-free stretching. It looks the same, but it's different. Here is isometric, here is stretching. Pain-free hip abduction exercises against elastic with 10 repetition maximum. And as I said in the theory, this 10 repetition maximum can be a weight of 30 kilograms sometimes for a professional athlete. Okay, it's quite significant weight. Body weight, Copenhagen exercises, 10 repetitions, pain-free. And then the athlete should be able to run 10 times at maximum speed for 30 meters with no pain, and the athlete to do the T-fitness test at 100% with no pain. And 100% means at least for a male athlete 10 seconds, 10.5, and for a female it means 10.5 to 11 seconds. Yeah? So this is for your adductors, rehab, and return to sports. And then we have the Copenhagen exercise. Copenhagen exercise is here. Sorry, Copenhagen squeeze test. Go back. So here, I ask my client, push me, my athlete push me strong, close your legs, strong, 1, 2, 3, 4, 5. And I ask them if they have any pain. If there is any pain, this will be adductor related, because what was contracting there was contracting her adductors primarily. And here, this Copenhagen 5-second squeeze test is a very good and valid criterion for growing health and function related to adductors. And if the athlete has no pain, I'm very happy, can continue normal, no worries. If the athlete has pain 1 or 2, again, no worries, but it needs to make me think why they have pain. Maybe the athlete will continue train normal, but then I will need to have a quick look with the athlete and maybe introduce some adductor exercises like Copenhagen, if they are not already doing. If the pain with this squeeze test was 3 or 5 out of 10, then the athlete stops training. We investigate, we examine the patient to see what is happening, and then after this we will continue playing. If the athlete has high levels of pain, 6 and above, completely stop training, and then you have a series of investigations, maybe an MRI, an ultrasound in the area, because this level of pain is very high, and the athletes, they need to definitely start having rehab. Yeah? So Copenhagen 5-second squeeze test is a very reliable indicator for the health of the groin, especially with regards. And then we have this fantastic exercise, the Copenhagen exercise, which can be used for all the above. Whether the athlete has green, pain 2 out of 10, or the athlete can have pain 3 or 5 out of 10, or even red, the athletes, they can start these exercises. And there is research in the football team, so that in the football team that they introduced this protocol for 8 weeks, the adductor strength increased by 35.7%. That was the protocol here, discussing the theory. And there is more research from the United Kingdom that the risk of the injuries reduced by 41%. And this United Kingdom research, they used 3 levels of Copenhagen exercise. They used this one, Jane Fonda, they used stabilization from the knee, and then level 3, they used stabilization from the ankle. Yeah? Good. And here another study, and we discussed about the total hip strength, it's important, and the asking port protocol, the repetitions, the extender, okay, every day, 3 times 12, 2 times per day, the diver, every other day, 3 times 6, and every 3 days, the glider. The glider is this. This is my injured hamstring. I'm stepping here, and then I'm gliding back my good side. And then I return. Wow. And I can have support from here. If it's day 3 or day 4, I could probably go up to there and then come out. But if it's week 2, then go there. If it's week 6, then go all the way up. Up. Yep. So it varies from the stages. And as we discussed on the getting the theory, in the rehabilitation, you have the Askling age test. It's important criteria for return. The fast movement, yes, very fast movement, but the athlete needs to be stabilized here and there, and then they do very fast movements, and then you can see the speed or confidence or pain, and if they are the same, then you can return. It's one criteria in combination with other criteria, but if they are not ready, 1 more week of rehabilitation. And then at the final stages of rehabilitation, you can use the Nordic exercises, but also the Nordic exercises can be used for prevention. And that's how they appeared back in 2002 as preventive exercises for hamstring injuries. And indeed, the teams that they use this exercise, they have around 30 to 40% less risk of hamstring injuries. Not only less injuries, but also better performance. The teams that they use this exercise, the players, they have a better 3 to 5 meter sprint speed. So it's also prevention, but also the athletes, they can sprint better. And remember what you said here, it's important that the athlete lowers all the way down. After 6 to 8 weeks, they can control the whole range. They don't need any hands, and they return. And then the partner needs to push them. And very important, push, pay attention to the neutral position of the pelvis. Okay, that's all.